Hello, Inova and families. I'm Mitch Cohen. I'm the co-director of the Heart Center at the Children's Hospital at Inova and the director of the Pediatric Arrhythmia Services. So happy Congenital Heart Disease Awareness Month. I know that Lucas, my partner, Dr. Colazo, has already talked to everybody. So I'm going to give you another great side of Inova. So I specialize in children with heart arrhythmias. So heart arrhythmias are where kids' heartbeats sometimes are beating too quickly and sometimes they're beating too slowly. I have a huge interest in dealing with these abnormal heart rhythms. And some of the times these heart rhythms can be quite challenging to deal with. They can really impact kids' lives on and off the sports fields. And with careful diagnosis, we can actually identify what the problem is causing these palpitations and actually take kids to the cath lab. So the cath lab is an area in the hospital where we can bring children in once we identify what the cause of their fast arrhythmias are, and we can actually put small catheters or tubes into blood vessels, find where those abnormal electrical arrhythmias are coming from, and actually either burn those little areas or freeze those areas and completely get rid of the heart arrhythmia. It's a great technology. It's one of the few areas in pediatric cardiology where we can actually cure kids. We can actually go in, find where those little cells that are causing all the problematic heartbeats and zap those areas, and in a matter of 2.5 hours, completely cure the kids of all the arrhythmias. And that's kind of a really neat thing and has really changed the lives of children over the last 20 years. The other area that I have a huge interest in is kids who may be at risk for serious life-threatening arrhythmias. We certainly hear unfortunate stories of kids who 1 minute are fine and either die in the middle of the night or sleep, or they die on the soccer or the lacrosse field. And some of these reasons can actually be due to hereditary arrhythmias. So I spend a great deal of my time evaluating children, evaluating their families with the help of our genetics counselor team to try to figure out, are kids at risk for certain sudden arrhythmia death conditions? And if we can figure that out ahead of time, we can save children, we can identify other family members who may have the same condition, and in doing so, then we can also save lives. And I think this is a really important avenue of where pediatric cardiology is from a preventative standpoint. So I think with things like screening EKGs or EKGs when kids have symptoms, we can hopefully identify those arrhythmias before they happen or before they become life-threatening and save lives as we move forward. So that's me in a nutshell. I'm also the co-director of the Heart Center, which means I get to lead an incredible group of talented pediatric cardiologists as we better the care for children with heart disease at Inova. So happy February, everybody.